All right, so I'm assuming have either never seen this. I mean, I recognize two people, three people actually. So I assume most of you've never seen this style or don't know very much about it. Is that kind of correct? Okay, you're curious. All right. So before we start, I want to kind of like give you something a little bit different. So if you can place both feet on the floor and close your eyes. And breathe out 3 times. See yourself in a room. In the center of the room, there's a box filled with balloons already blown up. Pick up a balloon of a color you really like and take the balloon with you to the window or the door of the room. The window or door are not open, open it up. Allow yourself to float up to the sky by the balloon. Hover out here in the sky until you find a place you really like. When you see that place that you really like, give the balloon string a little tag and land at the place that you like. Feel the air on your skin. Notice the light. What time of day is it? Enjoy being here. Take a deep breath and open your eyes. So we are in California. So if somebody wouldn't mind sharing and telling me where you landed.
Hawaii.
Okay, it was a beach.
Oh, sorry.
Oh,
sorry. Oh.
You landed in Hawaii.
Yeah,
Was it a beach?
Yeah.
Okay. What time of day?
Midday.
Okay, cool. Someone else?
Ocean Beach?
Ocean Beach. What time of day?
Now?
Okay. Anyone else?
It's in Point Lobos, Beach.
Okay. The typical places would be beaches, meadows. Some people land on a cloud. It's always light. Okay. If somebody tells you, sometimes people will tell you, I landed in this nice bistro in Paris. It's dark, blah 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 blah, but it's where they met their lover, sort of thing. You know. So of course it's a place that they like. It makes sense. But basically, the place that you want, that place that is always going to have light and space. These are two components of healing. I mean, people will say to you, well, what do you do? Well, I do healing or something, right? You know, something like that. We have alternative something acupuncture. What does it mean? We provide space and light, which you can see from this image. If somebody tells you, I landed in a cave, a dark cave, filled with snakes and scorpions, dial 911. They have a psychiatric disorder. No, I'm serious. There's something wrong. Tell someone, land in a place you really like. And where did they go? A dark cave with snakes and scorpions. It doesn't make sense, okay? So we know that healing requires space, light, and something that I call the knowledge of new possibilities. In other words, if you think that you can't move, if you can't heal, you can't. The mind has to open up to that. So as acupuncturists, this is what we do. We supply the space, the light, and possibly encourage new possibilities. Now, the big trick is, how do you direct that, this sort of large concept, towards technical issues? Okay? So from here on, everything is going to look much more technical. But I want you to always remember this idea that you need to have light and space and knowledge of new possibilities. Otherwise, all the technique you do in the world is not going to do it. Okay? So even though what I teach is actually technique, have some reverence towards this other stuff. Okay? So, the technique that I use is derived from Kiko Matsumoto. It's a palpatory technique, and I'll show you in a little bit how, all the details. What we do is we basically, now many people teach, well, there's not that many people teach this technique, but some people who teach this technique basically teach it as follows. If you find this finding here, use this point. If you find this finding here in the abdomen, use this point. That is one method of looking at that technique. That is very much not my method of using that technique. Now, if you went on my website, for example, and you looked at the materials, I have tons of protocols, use this for this, use this for this, if you find this, do this, if you find this, do this. In all likelihood, in this kind of condition, you will find X, Y, and Z. My main diagnosis is not pulse, I don't even look at tongues, okay? My main diagnosis is the body. I press on the body and I look at what's going on there. Okay? However, it's a little bit misleading, okay? And I'll show you that in a second also. Actually, my main diagnosis is what I would call medical history. My medical history does not come from the 10 questions. It literally comes from what happened to you in your life, in your own words. So I have this form, age, tell me what age it was and give it a name. Don't describe it, just give it a name, whether you can spell it or not. Just tell me what it was. And then I'm looking at the medical history and I'm looking at what the parents and grandparents have, and I'm sort of saying, okay, this person came, let's say, typical person comes for shoulder problem. 3 years ago I went to Tao and I went skiing and then I tumbled and this shoulder's been fucked up ever since. Okay? So look, people go skiing, they fall, the shoulder hurts for 2 weeks and it's over. Okay? Those people don't come to you. I mean, your cousin will come to you, your most loyal patient will come to you because they have an acute problem. But most people come to us after a long time that this thing has happened. Okay? You have to ask yourself, on a simple thing, there's no medical history in your shoulder, supposedly, okay? Your shoulder is, I went skiing, I tumbled, I got hurt. You can analyze it orthopedically, oh, it's a twist, it's a this, you can do different diagnoses, but generally, stagnation of chi and whatever you want to call it. By the way, I don't speak DCM, okay? So, I can communicate with it, but it doesn't mean anything to me, so don't ask me about spleen dampness or anything like that, just so you know it's not a common language between us. Okay? So something happened in the shoulder and you can diagnose, it comes from C5. You can do a lot of orthopedic issues, but it is not related supposedly to your medical history. It's not related to the fact that your mother had a cardiac condition or that maybe you have cirrhosis of the liver. Okay? In my system it is. Why? Because I'm looking at why do you still have a shoulder problem after 3 years? There's something wrong. The body should heal itself. Okay, you tumbled. Something happened, you got an injury, and then the body moves on. So there's something in your medical history, and that's my job to find out what that is preventing this shoulder from healing. And that's why it's still stuck 3 years later. Okay? So when I look at the medical history and I'm going, okay, this is probably significant, and there are things I may not understand are significant until I start poking on the body. And I try and remember all of that medical history, which of course is often impossible. We often don't really know. And then I listen to what people sometimes, they write their medical history, but then they don't write everything, but then they spill something out. By the way, I do this, I take this pill, I take, so then you have more things. And I'm trying to look at, if I treat the medical history, will the abdomen get better? Will the symptom get better? Okay? So just like some people they tell you that they can take the pulse, and after, whether they needle or they touch the point, they somehow can tell you that the pulse is better. Okay? If you can do that, fabulous, you're a genius. In my opinion, for me, I can't do it. Maybe when I'm 80, 90, 100 years old, maybe I'll be able to do it. It's too subtle for me. The pulse changes all the time. How can I trust that the pulse changed because I put a needle in? All the time I'm feeling the pulse changes under my fingers. It's like, how can I be so arrogant to say the pulse changed because I did something? It just doesn't work for me, okay? The abdomen, on the other hand, if you press on the abdomen, then you press on a point, the abdomen changes, that's very clear. Because I can press on the abdomen 500 times, and they'll say, ouch, not pleasant, not pleasant. But then you press, say liver 4, and they say, oh, better. Okay, there's a clarity. So the whole purpose of this map of the abdomen, okay, which everybody wants the map of the abdomen. No, because we all want the essence of things, and we all think we understand what the essence is, and the essence looks like it's, give me a map of the abdomen. What does it mean if you have pain here? What does it mean if you have pain here? And then give me points to treat that. And that's what everybody wants. Okay? So if I just do that, that's not enough. What I need to do is I need to try and look at what is the root. Why do they have it? That exists in TCM also. Okay? You've all used Giovanni Foundation's book in school, and what does he say? Okay, he says, on etiology. What's the etiology? And this comes from Suwen 1. The etiology is never, what we've done is we've done what Western doctors do. We've put people in boxes. You have spleen Qi deficiency. You have liver Qi stagnation. But why? Okay, you're describing what there is in your language, and everybody's going to have a different language. So if you're Western doctors, you'll say you have a thyroid condition. Well, why? Because if you don't address the why, you're just addressing the symptoms. So we've created a holistic Chinese medicine that's actually not quite holistic. You go back to chapter 1 of the Suwen. Why are all the diseases there? Lifestyle. They don't eat right, they don't sleep enough, they overwork, everything we say about nowadays, right? So imagine it was like that 2,000 years ago, how much worse it is now. It's like in China, they didn't have iPhones, they didn't have the capacity to communicate like we, get busy like we are, okay? So, very clearly, food, overly busy mind, not taking care of oneself, not resting, and emotions. These are the causes of diseases, and you have this TCM text, Giovanni's, he says, yes, you have the spleen and stuff, but you need to look back at where did this come from? You need to look at how did this person get to this problem? What we tend to do is we tend to look at medical history, okay? Now, why do they have this medical history again? So we're always going to say, well, there's some sort of domino effect. The first injury created a blockage for the second injury to heal. So the second came in, then the third, and the fourth, etc. Okay? Ideally, now this is a highly idealized description of a treatment, you find the origin, the original injury. You treat it, and everything falls like a domino effect. When I say everything falls like a domino effect, I mean right here, right now, not over 10 weeks. Whether it holds or not is a different story. Okay? So the essence of the technique for me is medical history, abdominal diagnosis, find out what's in the abdomen, correlate the two, make some priority. Now you understand that doesn't mean much to you because you don't know how to do that, but prioritize what you think is important. That means, conceivably, what's most painful in the abdomen? What finding do you think is important? Certain findings are going to be more important. If somebody has adrenal, we believe that's deeper and tends to take priority over other things. Just like when you say kidney in Chinese medicine, is a deeper organ. Okay? What's the first injury? And then you're also looking at what's the symptom. Is it related? Does it make sense in the context? And then you try and treat what you came up as the synthesis, as your diagnosis. You prioritize the diagnosis. You test your diagnosis by saying, okay, this diagnosis, kidney 7 is supposed to be the best point. You press kidney 7, now you can't check the medical history. It doesn't go away. It's there. It's done. It's in the past. But you can check if the abdomen changes. If the abdomen is changing, it means you did something. You pushed something. Can you be sure? No, you can't. You really can't until the next time the person comes next week and he says, now, the other thing you're checking is the symptoms. By the way, is your shoulder better now? Now, kidney 7 was a bad point because it happens to be a good point for shoulder. So I won't. But say, spleen 9, they had appendicitis. By the way, I had appendicitis, my medical history. Spleen 9 is my point for appendicitis, and wow, my shoulder is much better. Okay? So it gives you confidence. Yeah, I'm doing the right thing. Abdomen changed, shoulder changed. I believe I'm doing the right thing. Now, they come back next week, and they can say to you 2 things. Okay? Well, there's more than 2 things. Number 1, wow, my shoulder is great. I don't need to come anymore. So you go, well, that kind of sucks because you're not going to refer anybody because you haven't been here 20 times to really get to know me, blah, 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 but okay, but my ego says, wow, this is cool, okay, so that's good. The other type says, wow, that was good, but now it's 70% better than it was, but there's still 30%, so now you're convinced that you need X amount of treatments, etc., etc. So, and then there's the type that says, that treatment was great. Because you know the treatment was great because they tell you my shoulder is better. They move the arm. I mean, we're not talking about the ones you didn't succeed. We're talking about the ones that you did spleen 9 and it worked. Okay, the arm goes out. They couldn't lift their arm, but now they can. Okay. The one that comes back the next week and they say, last Tuesday I was here and the shoulder was great and it was fine until I went to sleep, but then in the morning it's all back to where it was and maybe even worse. Or it's back 80% of what it was. It's like, that's the kind of patient you don't want to hear. It's not that you don't want them, but it's unpleasant for you and it's unpleasant for them. And they're not likely to come back. Because the worst thing you can do to a patient is give them hope and take it away. Okay? So you gave them hope. Wow, my shoulder's great. And then the next morning, oh, fuck. So one of the first things that many people will do is like, I'm not going back to that charlatan. Because now they're going to want me to come like my whole life, come every day to make your shoulder better, right? I mean, we know that there are professions, unnamed professions that do that, okay? So it's not a good thing to do, okay? So only the following week can you really tell. You evaluated your diagnosis to the best and treatment to the best you could by, yes, the abdomen changed, the neck changed, the back changed, and by the way, the symptom changed. But until they come back, you can't be sure because it could be temporary. So what you're looking for is the kind of treatment that lasts the longest. Okay? That's really what you're looking for. Okay? So, and that's the real evaluation, you may change your mind, not only 5 times during the treatment because you try this point, no good, this point, no good, this point, 30%, until you find what you wanted, you get what you want. And then when you get what you want, that still could be misleading because the next week the person can come and say, no, sorry, looked good. And what it tells you usually is you're on the right track, but you have not addressed a root issue. There's a root issue that you're missing. And now you have to go, what is it? And it could be something that was on their intake sheet, their medical history, but you didn't pay attention to. It could be an abdominal finding that you didn't pay attention to. You don't know what it's going to be, but that's the trick here. Okay, to find not only what addresses the symptom, but also what addresses this person, the root, what we consider to be the root of the person. And 2 different people can come up with 2 different roots, and it's totally acceptable. Okay, all that matters is the person gets better. So I want to show you, can I get someone who's willing to expose their abdomen on the table? It's not for treatment right now, but you're still willing. If you don't mind lying down. So I want you to see, first of all, what I do, and then, so poking abdomen. Okay. So the first thing is, I have a colleague in Israel, and he teaches literally poking like this, and it drives me bananas, okay? So I go from my body, I press from my body, so I'm basically leaning into her, okay? So I'm not doing, this is not pleasant, right? Okay, this is much easier, right? Okay, so that's very important, that you're moving from behind your heart, I'm using 3 fingers, they're soft, you should be able to get up to 1 knuckle in, okay, on a normal person. Okay, and most people, if you're before the 1 knuckle depth or at it, they go, ouch, not pleasant. And what I usually do is I go, most people, not everyone, left spleen 9 will not show very much. Okay, by the way, if you want, you can come closer. So usually the left spleen 9, unless they have colitis or something on the descending colon, they're not going to mind here. Okay, it's that they should, so they know what my fingers feel like. Otherwise, they have no idea what it feels like. Okay, so then I go, hi. Anything?
No.
Anything here? I think yes.
A little bit, yeah.
Okay, a little. Anything here?
A little bit.
And here?
A little more.
Okay. Ren 9?
No.
No? Was that a no?
Yeah, no.
Okay. Fit 12? Yes.
Yeah.
50. Ooh, okay. A little too much worry. High liver versus spleen side. Yeah, more on the liver
Oh,
side.
yeah.
Okay. So this is not the full diagnosis. Don't worry right now about it. I just want to show you that the abdomen will change. Okay. So up to now you had adrenal left, adrenal right a little bit, longo digestion, REN 12, and REN 15. Oops, and a little liver. And okay. And this was the major one. Now this is a little harder to stretch this way, but I just want to show you a quick thing. Lift your legs. No, relax them, relax them, relax. Thank you. Okay, the boots on, so never mind. Okay, relax and breathe. All I'm doing is I'm stretching out the fascia in the abdomen this way, okay? Okay, let's see what she shows now, okay? The reason I'm doing this is so you see that the abdomen's not got. Okay, you big one.
Yeah, nothing.
Nothing. Okay. I wasn't sure I'd be able to get there because it is a little too far up. Okay. Liver,
Not that much. Yeah.
Okay.
A little bit.
12.
Mm-mm.
4 o'clock, 8 o'clock, digestion.
Fine.
Okay. I didn't treat her. Okay. So to say that to treat the abdomen, to make sure the abdomen goes better is not the treatment. It's a checking mechanism. Okay. My diagnosis is related to her abdomen. Now, this will come back in like 5 minutes, the way I did. But all I did was I stretched the fascia. Therefore, the fascia is not showing the same congestive areas. Okay, that's all. Okay. Now the trick is really, I can't do it on her now. Thank you. On other people, what we do, okay, let me get someone else to show you a different, you know, if you don't mind taking the boots off though, because, no, because I want to be able to use your legs. Of course, I haven't asked anybody about medical history. I mean, right now we're just dealing with the abdomen. Okay, so this is just my fingers. Okay, if anything is uncomfortable, let me know. Now, what you can do is sitting. It's not so comfortable for me personally. I tend to stand. Kiko sits and Kiko holds them like this. Okay, it's kind of nice for them. Hi, any here? Because this way they're secured. Because this part is invasive. Okay. Anything? Yes. Okay. And you're gonna have a pulse here. Okay. And hi, anything here?
Little tiny
A
bit.
little.
Yeah.
Okay. Here.
Yeah.
Okay. And here also.
Yeah.
Okay. So she has. We call this adrenal on the left side and adrenal on the right side. I'll go over all of that in a second. How about REN 12?
Little
15? Okay. So you had digestion, adrenal, REN 9, and a teeny bit REN 12. Okay. So I'm gonna make the assumption right now. I don't know anything about what's going on. I have no clue. I haven't checked the neck. Blah 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 blah. Never mind. I have an idea for something else, but because of something too difficult to explain right this second. I'm going to say adrenal. I told you adrenal tends to be deeper. Now she could have a whole bunch of things that I can't diagnose from the body. Like she can have blood pressure issues. She can have don't say anything. She can. There's a whole bunch of things that don't have clear reflexes. Okay, not everything. You can't say insomnia reflects here. This one reflects there. This one reflects. Not every symptom has a reflex that is unique to it. Okay, so but from the medical history, then I have for insomnia I'd use this. For this I'd use that. So then I'm combining different. I'm not just taking the body, but right now I'm working just with the body, and I'm saying 1, 2, and 3 sound like the most important things to me. Okay, I mean they'll first of all, because I know that they're important, so excuse me. Okay. No, it's okay. Hi, how's REN 9 now?
It's okay.
Better?
Yeah.
Okay. How is this guy?
Not much there.
And how is this guy?
A little better.
Okay.
Yeah.
Now, the official dogma for adrenal, this is not what we normally use for adrenal, but because she has REN 9, we call this weak dantian. My solution to this, I'm different than Kiko with this. We call mushu, okay, which is REN 4, take it to the side between the mu and the shu. Okay, mushu. Okay. So this, it comes from there's a whole explanation why, you know, I have this understanding why the side treats the center. It's to lift things up, to strengthen the lower dantian. Okay. Now so just like this is really just to show you a method of working right this second. Yeah. No, she has shorts on. Okay. So here, right?
A little bit, yeah.
Okay. Any pain on kidney 2?
No.
Okay. When I press kidney 6, how is adrenal reflex in the belly?
It changes a little bit.
A little bit.
Yeah.
How much is a little bit percentage? Sorry?
20%.
Okay, it's not the right kidney point for her, in which case.
It's tender.
Forget kidney 7, how's kidney 16?
Good.
Good.
Yeah.
Okay. So this is really this is what I do. If she says good, I stick a needle, but I don't stick a needle right now. I have to make sure that kidney 7 also changes the whole abdomen. By the way, changes your symptom. Do you say this is just talking abdomen, right? So one of the things a lot of people do is they find a point, they stick a needle. No, you find a point to remember. First of all, make sure it changes a lot of stuff. Make sure how important is this point. This is called prioritizing. Just because it changes one point doesn't make it's not worth anything. So what? So you change one little thing in the abdomen. Does it change lots in the abdomen?
And you would check if she had a shoulder problem.
If she had a shoulder pain, does it work against the shoulder? Does it change her symptom? Does it change? So one of the things what's difficult for people who follow me, in following me, is that there are all these protocols, and then I start saying to them, well, but they have this, use this protocol, and they're going, but it's nothing to do with this point. If a point is right for a person, it changes lots of things in the abdomen, even though that point by dogma, by theory, is not related. We can say kidney is related to this kidney 16. The adrenal is related to kidney. Adrenal reflex relates to kidney. But I can change, I showed you, I can change adrenal reflex with other things. That's sort of, I don't want to say it's unique to it is kind of unique to the way I teach, unfortunately. I'm not following the dogmas so much. I'm kind of like, my whole thing is how do you undo the dogmas and go beyond them? Okay, so that makes it a little harder to study with me because I know I used to be the person who teaches the systematic approach to Kiko. Okay, and I'm no longer that person. Okay, it's just if you want that, if you really want the A, B, C, I'm the person who goes A, B, C, D, and by the way, now let's make an alphabet soup. Okay, so that's just the unfortunate part of if you study with me. Okay, thank you.
Yeah, of course.
All right. So now let's go through some protocols. So we have a comment. So now you've kind of seen what it looks like. I mean, it's very vague. And then we'll have people with real needles, with real problems, and we'll deal with things. So let's go through some protocols. Okay. So
for the digestion point, that's kind of the right.
I'm going to go through all of that. Okay. Now, because we're filming, you don't have to take notes. Because I know how it is. You take notes and you miss something, and you want to, don't worry. You can't learn the whole system in 3 hours. Okay, it takes a while. So we all start teaching with left stomach 26, 27. We call this oketsu. The translation of oketsu is stagnant blood. Be very careful of translating it into an idea that says something like Taura and Hongwa. Okay. What it means is that the blood is a little bit sluggish. Okay. It comes from the idea that the liver is here on the right side, the portal vein comes from the left side. And then because the liver is holds a lot of blood, if the blood is more viscous, what will happen is in the portal vein, it will show, the portal vein, there'll be a backup in the portal vein, and it will show here. That's why you can say this is somewhat of a liver. Okay? Even though by Nanjing, supposedly liver should show on this side. Okay? We call this stagnant blood. This solution, so I'm going to give you a reflex, and I'm going to give you the treatment points. The treatment point for stagnant blood is a combination on the left side of liver 4. Now I know most of you don't even know where liver 4 is because nobody uses it, but our liver 4. So first of all, I see lots of people typing liver 4 where I would go stomach 41. Liver 4 is on the medial side of the tendon. Of all the tendons, I don't care how many you think. Now, but the unique thing about us is we don't take it level with the ankle. We take it a thumb below, and we needle upwards. Okay, liver 4 is a really important point in Lingshu chapter Lingshu 2, when it talks about all the different points. Sorry, 2 or 10. Hold on, I'm confused. One of them doesn't matter. It talks about all the 5 elements, you know, the major points below the knees and stuff, the 5, not the 5 elements, you know, the jingwell, the, you know, blah, 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 the shoe points. One of them, he stops and he says, when you needle this point, liver 4, needle it with the channel, you create harmony in the abdomen. Needle it away from against the channel, you create havoc, chaos in the abdomen. The only point he has anything to say about. So something interesting about liver 4, and interesting, TCM, it's like it doesn't exist. Liver 3, liver 2, liver blah blah, liver blah blah, liver 4? It's like, it's kind of interesting to see like how different people have different ideas. So liver 4, left side, lung 5, left side also. Our lung 5, if you read the description by the TCM, they want it close to the tendon. We don't take it so close to the tendon. We go further out. Okay? And it could go slightly below the crease, slightly above. You just check what works best. Okay? Now, why do we all teach Oketsu first? It's easy. It's convenient. There was a time in the 90s where we thought everybody had Oketsu. And it was probably true. I was working as an acupuncturist, and I can tell you lots of people had Oketsu, but I'm working as an acupuncturist now in 2014. And I can tell you that barely anybody has Oketsu nowadays. Yeah. My own belief is times have changed. Between the 90s and now, we've had 9/11, we had economic downfalls, and we had all sorts of, I'll call them democracy downfalls. Okay, the whole tenure of America, I work in America, I teach outside, but patients I see mostly here. The American culture has changed from the Clinton era by the time we got to Bush number 2 era. Okay, it's just the nature of it. We are much more fear-based and nervous system problem-based and autonomic and autoimmune disorder-based than we are too much wine, too much cheese. You know, it's a different culture. Okay, therefore the body is shown differently. For example, a finding we find lots of nowadays is when you press on red nice or anywhere around the navel, you're feeling a pulse. And where are you? No. You. She had it, which I use the mushu for. That's an extremely common finding. Extremely common finding nowadays. It was not a common finding in the 90s. Okay, so with culture, with times, things do change. Okay, so the next finding, so Oketsu used to be important, but now we still teach it because, well, you know, it's convenient. The next finding we call is the adrenal finding, and we call it 4 o'clock and 8 o'clock. Okay, so it's not kidney 16, it's just below. It's like if Ren 9 was 12 o'clock, okay, Ren 7 was 6 o'clock. Kidney 16 is 3 o'clock and 9 o'clock, we're at 4 o'clock and 8 o'clock. It's just, Kiko has a lot of imagination. She likes cute things, and it makes people be able to remember things. So it's kind of 4 o'clock, 8 o'clock. You know, everybody remembers 4 o'clock, 8 o'clock. You know, although kidney 16 is like, too complicated. You know, we say that reflects adrenal. What does it mean, adrenal? It can be 2 kinds of things. One is you had a shock. One big shock, or like over time you exhausted your adrenals, like you're going kind of person. So if you think about it, some of you may have like the kind of dreams where you think that you can analyze my psyche afterwards if you want, but you're somehow tied on the railroad tracks and the train is coming and you can't escape. The natural reaction is you're sinking into the navel. Okay. That's one way to look at why it reflects there. I have another explanation for it, which is a little bit more complex. which is, do you remember the description of the kidney channel? Starts at the little toe and goes, you know, through kidney 2, circles the ankle, comes up the inner leg, goes into the perineum. Now we can go back to the body. Goes up the spine, and now everybody who's read this is going, what? That does not make sense. I know that you all did that. From the perineum, there's a problem with the kidney channel because the description and the points don't match. They just don't match. It goes up the spine, and you're going, what happened to kidney 11, 12, 13, 14, 15, 16, right? Then it goes down to the bladder, to the kidney and the bladder, which all channels do, and then it goes up to the chest and circles in the throat. That's the description. But the points appear to go from the perineum, kidney 11, 12, 13, 14, 15, 16, up to 27. The points are wrong. The numbers are totally wrong, in my opinion. Okay? Because if you read the description, it goes perineum into the spine to the, now it goes down, so it goes to kidney 16 down, not kidney 11 up, 16 down. And then from 16, a separate branch goes up. The channel splits at kidney 16. Kidney 16, obviously energetically, it's in a huge place. It's by the navel. It doesn't get more central than the navel. You know, it's like this is where life came from. You know, this is how your life is being sustained. It's super important. Secondly, as it comes in kidney 16 by name, it's called Huang Shu. Okay, Huang. So it has the character for the body and missing. I'm missing something here. Another.
No, the Wang is on the
yes,
top.
I understand
Yeah.
The organ is opposite. Okay.
Mhm.
This is something that's missing. Something that when you're dead, when you have a funeral, you're Wang, W-A-N-G. Huang is in the body missing. Something's missing in the body is Huang. Okay. This Huang Shu, I know they say between the pericardium and the heart, something, I don't know, something. That's an interpretation. But the character itself means missing. It's something, the shu of something that's missing. Kidney 27, the shu of the Fu organs. Fu shu, that's the name of the point, I didn't invent. All the other shu points are only in the back. Okay, you only have shu points on the bladder channel, and then you have 2 shu points on the kidney channel. 27 and 16. So there's something in this missing place, and it's the place where the kidney channel splits. So in a shock, we know that kidney is affected by fear, right? In fear or shock or something like that, the kidney channel splits. And that split, that drop, will show just below kidney 16. So that's just another way to say, you know, to why there. Not everywhere we know why. Now, the treatment for 4 o'clock, 8 o'clock for adrenal, original treatment was kidney 6 plus 27. Okay? Kidney 6, we needle down towards the Achilles. Kidney 27, we needle towards the center. Okay? Now, that's original. Now, we have one other reflex for adrenal, which is, do they have pain on kidney 2? If they do, they may not show below kidney 16, 4 o'clock, 8 o'clock. We would still consider that adrenal. But instead of kidney 6, we use kidney 7 plus 10 plus 27. Why? We have this understanding. If a fire point is painful, we use the metal and water points on that channel. Okay? So this is like a primary rule for us. Pain on the fire point, use metal and water. That dictates, that overtakes pretty much most other considerations. Okay, so if you want to use a point, like say you want to use pericardium, does pericardium 8 have pain? Okay, yes, use pericardium 3 and pericardium 5. Okay, pericardium 8 has no pain, you can do whatever you want. Now, because pericardium channel is important for us, we actually have some rules about it. We say use either pericardium 4, which for us is 3 fingers below pericardium 3, not down here, and or you can use pericardium 6. You have a choice. And I'll afterwards show you how. So that's something you may want to kind of remember, because we use autonomic nervous system disorders, we use pericardium a lot. Okay, so if I say use pericardium, it means check pericardium 8. Painful, do pericardium 3 and 5. Do not assume the other side will be the same. Each side have to check on its own. People with autonomic nervous system disorders typically will show differently on each side. That's part of the disorder. That's part of the reflex for me. Okay, so that was adrenal. We all kind of together just to get some protocols. Right stomach 26, 27. Okay, that can have 4 different meanings. Okay, number 1, it's an immune reflex. Number 2, it's a lung reflex. Number 3, it's a digestive reflex. Number 4, it's a pelvic shift. The kind of person who's walking like this, one hip's higher than the other, they have a sacroiliac problem, they can show here. If it's a sacroiliac problem, you probably can't fix it from the front. You can do something. Don't worry about resolving this. How do you know it's that? Press from underneath, press on the sacroiliac ligaments, and check left stomach 27. Chances are it gets better. At that point, you figure it's probably structural. I may have to deal with it. I mean, I can do stuff in the front, but there's a good chance I'll want to deal with it from the back to begin with. Okay. Now, I always do front treatments and back treatments. No one leaves me with just one treatment. Okay. So you're talking double treatment. This style is work intensive. Okay. But it's less talking. Okay, if you can, I mean, no, it's like we don't talk as much with people. It's digestion and immune, it's pretty obvious, it's pretty much on top of your appendix. Okay, so ileocecal valve, so much of your lymph nodes are around your intestines, so it kind of makes sense. And because of that, because the mucosal membranes of the intestines are basically there's a similarity between that and the lungs. I mean, you can go Chinese and say lung, large intestine if you like, whichever way you prefer to think about it. So you have 4 options here. If it reflects immunity, there is another area that could reflect immunity, and that's Sanjiao 16. That's behind the SCM, and we press it. The person's lying down, you're pressing it up towards the nose. Now, can I have someone here for a second? So, down. Okay, actually, let me go a little bit that way. Okay, let go. Okay, so you can see. Okay, I'm doing this side. Sanjiao 60, I'm pressing towards the nose. Anything?
There.
There?
Yeah.
Okay. We call immune point. Originally, now going to call it tonsillitis point. I'll show you on this side where I am. It's okay. So I'm pressing up towards her nose. Okay. So on this side, what I do is between large intestine 11 and 10, but on the edge of the bone, so that makes it a little bit more like the triple warmer. In fact, in my opinion, it kind of is. And I'm looking for the way the muscle is knotted into the bone. And when I find it, now I keep my hand on Sanjiao 16, and this is a great way to train your hands. This is one of the few places you can find it. When you press on the immune point, I will feel, in this case it's above my finger because it's towards her nose. I'm feeling something open. Now, hi, anything? How's that now?
That's better.
How much better? Always ask how much.
Like 80.
Okay.
Yeah.
Because people will say, there's the kind of person that says it's better when it's only 5% better. And there's the kind of person that says, and it's really 90% better. So get used to asking people to be precise, because without the precision, you don't know. Until you know the person, you don't know what they mean. So now, be aware that the immune point is an area. It's not a precise place. It's never quite large intestine 11. It's never quite large intestine 10. It's somewhere in between, and it's on the bone. It's edge of the bone, rather. There's something about how muscles attach to certain bones. That's true about the iliac crest, by the way, also. That relates to the immune system. I don't quite know how and why, but that's immune point is a huge deal. Now, if she has, okay, do you have any? These are just my fingers. You didn't like this, it sounded like.
Yeah, I don't.
Okay, so if it's immune, by the way, hi, how's now?
About 10%.
Only 10% better, or
Yeah,
10%?
10% better.
Okay, so maybe this is not just immune, or she has a whole bunch of other things that need to be resolved. We don't know history, we don't know what else there is in the abdomen. This is exactly what I'm trying to warn you against. Don't do she has immune, boom. Okay, now maybe she's lungs, we don't know her history. So if it's lung, I can actually usually we use same treatment point and reflex. I'm always using same side for same side. This is a case where I can use opposite. So lung 8. By the way, if I ever say lung 7, assume I meant lung 8. If I say lung 8, you can assume it's lungs. It's the same. We don't have a point out of line. We don't have this understanding. Okay, it's the same point. Hi, how's now?
About 40.
Hmm?
About 40%
40%
better.
better.
Yeah.
Okay. So chances are she's really a lung immune complex, and there's a good chance. Now, you did not have appendix removed. Okay. Yeah, no, I saw. Okay. If it was appendix, it would be a spleen 9. But she could be digestion, for example. Okay. She could be all 3. She could be all 4, by the way. Okay. Hi, how's now?
About like 25.
25. Okay.
Yeah,
So best
more
one up to now is the lung one. Okay. So that would be my assumption. Okay. I'm kind of looking, I never start a person like this without talking, like without knowing what the hell am I treating here. Yeah. She's just here so we can see something. So, I'm curious if we should, no, we'll let you go right now.
Okay.
Okay. So that's, you had a question on that, right? Oh, wait, one more. Because she can be one more option, which is a digestive option. Okay. She only said 25% with spleen 9. Okay. It's here, right?
Mm-hmm.
Okay. Hi.
It's like 35.
She's stingy. No, it's okay. I changed angle a little bit.
Yeah,
Okay,
that's
so-
like 50.
Okay. Do you have digestive issues? Do you have candida or some
I have
parasites?
like toenail fungus, so like
Oh, okay. Can't guarantee that it also exists here,
Yeah.
but hold on, anything here? Because fungus loves liver. Okay, and also all the medications, don't you watch television and they say, take this for your toenail fungus, and by the way, the side effects is you'll have a fucked up liver.
Yeah.
It's like, yeah, which one would you rather have? Not so nice toenails or a fucked up liver? It's like, I think I'll have the medicine every day, 3 times a day. Like, I don't get it, but people do it. But if you have a fungus, you want to check the liver, that's all. But compare left side and right side.
it's a little more tender on the right. Not too bad.
Sorry about fungal.
No, it's fine.
Hi. Better?
No, but it's not. It doesn't.
Okay, hold
yeah.
on. Is this guy better?
No.
No. Okay. So yeah, it could be other liver options. So let's just to show you, checking fire points. Liver to pain?
No.
Yeah. Okay. I'm just asking.
Yeah.
It doesn't have to be. And I'm checking to see if she has weird stuff on the liver, especially around liver 5, but she doesn't. Okay, so that's not a good option. But yeah, okay, here's another option because you are a little bit in. Do you always have these spots here?
I live in the Sunset. It's fungus. It's like damp.
Okay.
Yeah.
Oh, hi. Sorry about this. How is now?
That's better.
How much better?
Yeah, like 50, 60.
Okay, 50, 60. And can I have you, can you
Yeah, actually, that's better. Yeah.
Can you press here down that way? Don't press too hard. Don't make her scream. Want to make me look good, right? Hi.
That's worse under the thumb.
Forget the thumb.
Oh, sorry.
I don't care about the thumb.
Okay. Then yeah, that
How much is left here in stomach 26, 27? The one
actually
I'm vibrating.
like
Nothing.
that's nothing.
Okay.
Yeah.
Okay. So I have to treat fungus plus treat the liver. This is a fatty liver treatment. So, all right.
Yeah.
Thank you.
Yeah. Thanks.
All right. So does that answer your question about what would I do for right side stomach 26, 27 digestion?
Yeah, it's just.
It's not the only digestive reflex, by the way.
So that just Keiko calls that immune.
Sorry?
Keiko calls that immune zone. So but you also.
It's immune or lung or digestion or pelvic shift. All 4 of them are options. You can't tell what it reflects until you try the treatment once.
to explain to patients and use words like immune because they start asking questions. You have to
Totally your decision. If you are someone like Kiko, you don't explain nothing. Boom, 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 get done. I don't want to talk to you. Like, well, why am I wasting time explaining to you medical terms? I mean, I don't ask you about carpentry. Why do you ask me about, you know? No, I understand. Not everybody can do that.
Yeah.
So immune basically means people, for example, they have the tonsils out, adenoids out. They are always sick as children. You know, they have a weaker immune system. So, but, you know, how do you explain to someone, you find cardiac reflex and you say, you know, you can say, wow, cardiac reflex, and they go, ooh, and they don't have, but the family has cardiac history, so you say, energetically, you've inherited weakness in the system, therefore, it shows. I don't know if when you're 70 you're going to have a heart attack or not, I can't say, but I can say that energetically, you're weak. People who've had, you know, come from certain ethnic backgrounds, for example, Germans, Irish, often will show liver. They say, I don't drink. But your ancestors, you know, generations of drinkers, your liver already shows weakness. Okay? So you just have this weakness. It's okay. It's not the end of the world. But, you know, and then if you treat this weakness, other things get treated. That's the point here. My point is not to diagnose. See, I'm not the kind of person that, you know, in Western medicine, you diagnose and it's in stone. It's like, you know, you get sent to someone, they're going to read whatever they read, blood tests, MRIs, blah, 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 and they come with itis, okay? And then you say to them, there's a few options here. Number one is, don't ask me how to treat it because I'm only a diagnostician. That's very typical in Western world, okay? That doesn't interest me. I'm not here to name things. I'm here to treat things. If I can't treat it, it's as if it didn't have a name. It's irrelevant. I have to fit it into something I can treat. Okay. So the other option is you say they go to that. So they'll say to you, "Oh, go next door. They're an expert in treating itis. I'm the expert in diagnosing. They're the expert in treating. Okay? I have to be both at the same time." And the third option in Western medicine is we only know how to diagnose. We don't know how to treat. Okay, so I'm not interested in any of those except if they both come together. You're thinking about something.
In San Francisco, at least based on my experience, a lot of times, you know, a lot of these patients are highly educated. They come in here, they get treated. They will ask questions. And one thing.
Are you trying to say that Boston?
We
have Harvard.
I have no experience with Boston.
No, I'm kidding.
Because this is from what I've seen, this is a real issue. And Keiko's methodology, when you start introducing these vocabularies, it's just like opening a can of worms. And so I get into a point, I try not to say anything. I just all I'm trying to do is just open up.
Okay, you want to know how Kiko works? Hi, how are you? She looks at the form, she talks to you for maybe 2 minutes, if that, and she does her thing, she doesn't give a damn. I mean, she's, sorry, that was not very nice to say, but she's not into talking to people. And then the moxa person's there doing the rest of the work. Now, the person may talk to them. If she talks to patients, it's usually, she may ask them just one particular thing about their medical history. And that's a method of working. Now, that does not, you, as it happens, could probably pull it off in San Francisco. You just have to put a little stronger accent. And nobody will doubt anything. No, I mean, there are advantages that we as people, you know, I'm not American, but I'm white. I can't pull this off, okay? So you have to decide how you want to work with people. And if you prefer to work with people without explaining, you work without explaining. You choose to yes explain, you choose. That's what I told you is like, I'm teaching you a technique. The whole patient management or how you provide space, light, and knowledge of new possibilities, that's kind of like not in the realm of this class. Is that fair?
That's very fair.
I mean, it's not fair, but it's what I'm offering.
Like
Like
this. What you're saying.
Yeah. But yes, it can be a problem. And then what I used to do medical rounds for at UCSF and St. Luke's and different hospitals. And you know, I taught, you know, the doctors are very. I explain to them when I say the person has a thyroid type, it doesn't mean they show on the blood test. It means that's my understanding. All that matters is, in my understanding, can I figure out points that treat my idea of thyroid condition? Okay, and if it does and it treats their symptom, we don't have to argue if Of course they don't agree with me that it's a thyroid condition because they're looking at the blood test.
I understand.
So you can say to patients, this is my language. It may not correspond with your understanding. It's just a temporary latching onto words so that I can figure out what's happening in the body.
But the important thing is that you're using this common set of vocabulary, and people, you get to a point that you're using the same words, but you're saying, well, these words mean this to me, even though the population to them. And also, the other thing I think that's irrelevant. More important thing is, when Keiko or her master, when they do this, let's say they palpate right stomach 27 area, they say, okay, there's something wrong with the immune. Okay, so like you said earlier, the root, what else should you start looking for other than Central 16? So, do you start looking for other things to really find out?
I'm looking.
Should we take immune a little bit more literally, or just say, okay, that just happened to be the moniker?
Okay, give me. Okay, what it happens to be what?
Just the name, just a placeholder. We need to call it.
Nomenclature. Nomenclature. Okay. Yes, basically just treat it as a name right now. And I'll answer your question of how do you look deeper in a second. So we have once we have a little bit more capacity to look at things. Okay, because that is a very important question. You named it, and okay, so you said it's immune, but what I'm telling you is always look for the deepest thing. Okay, what caused it? So yes, it's a very good question. Why did you get to be? Now, at some point, you're going to have to stop asking why. Okay, otherwise you're stuck at what we call in Hebrew the lama age. Why? At some point you've got to say it's what is, and can I treat it and get some result. But it's up to a certain point you want to keep asking. Okay, and where that point is for each one of us is going to be different. So. But we'll get back to that. Yes.
Can you talk a little bit about some of the we have so far like a couple of these, I guess types, right? Or points that you would, or portions of that where you would prioritize on certain people. Can you talk a little bit about some of the features of those certain people, because you said a little bit there was
Honestly,
more
I can't.
obvious.
No,
but
don't go there.
No.
No. First of all, because I really can't, because that's something that takes a lot of. It's not the system. It just isn't. This is not a psychological system for one thing, and it's really no.
That's more your clinical observations over time.
Yeah. Don't go there right now.
Okay.
It's gonna be fine. It's like asking a PhD question at kindergarten. It's like way too, and there's no clear answer, in my understanding. Would you agree?
Mm-hmm.
All right, let's go through maybe just a few more. Okay, Ren 9. Originally we used, sorry, this is the navel and this is Ren 9. Okay, just about it. Originally we said Ren 9 is, we called it sadness reflex. Okay, so we used to call Ren 17 is anxiety, Ren 15 is worry, Ren 9 is sadness. Okay, that's cute. Okay, but that's what we call them. That you can agree or disagree. Nowadays we say Ren 9 if there's a pulsing, and lots of people are pulsing, and we just call it Ren 9 pulse, but it's really navel pulse. It's actually more likely to show on the left side to begin with. Okay, you should not feel the pulse. You should not be able to feel the aorta. So it basically means that the mesenteric tissue is weak because the aorta is close to the spine. Doesn't matter how thin the person is, you can't touch it. Well, if you feel, but with one knuckle in, you should not be able to touch it. So the fact that you can feel the vibration from the aorta, and some people you can see it on the skin, you can see the pulse. Okay, some people you just see vibrations. Okay, it basically means there's two explanations to it. One is the mesenteric tissue is weak. Number two, we say, what does it mean pulsing? It's the blood pulsing. What does the blood represent? The blood contains the emotions, correct? Okay, it means that the heart doesn't have the space, is incapable of holding the emotions inside the heart. There's only two channels that go inside the heart. One of them is spleen, and one of them is the heart itself. Okay, everything else that it touches the heart, all the channels that say that it doesn't go inside. Okay, so when you have frustrated emotions, it may show on Ren 9. That's where this idea of sadness comes from, I believe. I'm not totally sure, but Ren 9 pulse, the official treatment for it, this is the official Kiko Matsumoto treatment, this is what you will find in her books, is right side stomach 24, okay, which is called slippery flesh gate, Wyoming, okay, that's the name, okay. You have slippery flesh, and you have a point called slippery flesh gate. Oh, wow, treats it. Quite honestly, everyone I talk to says the same thing. Doesn't work. Alfie, why doesn't it work? No, I haven't seen anybody yet go to Kiko and say, Kiko, why doesn't it work? I'm waiting for someone to be like, I want to say, no, because like maybe she'll say something. So yes, there's been different modifications. Needle it slightly outward, angle-wise outward. We also nowadays add GB26 because Ren 9 pulse, because it's frustrated emotions, should show on the heart too, so it shows in spleen 20. Remember, spleen is the other channel, goes inside the heart. To release the pectoralis, we use GB26. One of the tricks that we have for shoulders, needle GB26 for if you can't lift the arm because the pectoralis is tight. If I'm tight here, I can't lift my arm. If I release this, the arm goes up. Huge trick, needle gallbladder 26 for shoulder problems where they can't lift the arm. But it releases the pectoralis, so we do stomach 24 on the right side plus gallbladder 26. Now, I'm telling you the honest, gallbladder 26 on the left. Okay? I'm telling you the honest truth, it's not the best combination for me. I only know one woman who said to me, one person, doesn't matter if woman or man, who said, oh yes, it works great, I do huge Kyotoshi, huge moxa on top of it, and it totally dissolves the Ren 9 pulse. Now she lives in Quebec where it's extremely cold, okay? So it's part, I don't know, I can't tell, it's out of someone else's patients, but I talk to lots and lots of Kiko style practitioners, and everybody complains about this Ren 9 pulse solution, that it's really, it doesn't seem to be the solution. What I find, do Mushu first. And strangely enough, I like to start on the left side of the body, but with this I actually start on the right side simply because it's convenient. Okay, press Mushu and see if Ren 9 pulse is better. You have a much better chance than right stomach 24. Okay, now we have this idea that the left side, you're going to hate this. The left side to us is the chi side, and the right side is the blood side. You're not going to like it because you've been taught exactly the opposite your whole life. So this is our explanation. The reason it really is kind of irrelevant for a beginner's class, but since I touched it, I'll explain to you. In the body, we have the intestine going up, across, and down. The down is on the left side. The up is on the right side. In the meridians, first of all, anything that goes down is what? Why? It came from the yang. It's going towards yin, but it came from the yang. So all the meridians, yang meridians, you can't argue that the stomach channel goes down and it's yang. The bladder channel goes down, it's yang. They're all going down. So yeah, I understand that you can argue, is going down yin or yang, but somehow they've already decided that argument for us. Going down means it came from heaven, meaning it's yang. You can disagree, but then you're not within the system of the meridians. That's the problem. What goes up comes from yin. Therefore, it's yin. It's going towards yang. I agree. I see that it's not so easy. Okay, that's why you've always learned right side is chi, left side is blood, and I'm telling you, we say exactly the opposite. The right side goes up. Therefore, to us, it's yin. It's going to be the blood side. The left side to us is the chi side. So we tend to start on the left side, and it's going to matter with symptoms that have to do with the chest, where it's chi. Okay, and then we sometimes have this idea that if the pericardium on the left side worked better, it's a chi problem, and if it's on the right side, it's blood. So it's how emotionally, how tight is it into the blood? How strongly bound is it? Okay, so that's not so irrelevant. Okay, so that was Ren 9. Then we have Ren 12. Ren 12 can reflect many, many different things. And actually, originally in the system, it wasn't, you know, we didn't treat it much like as a reflex, but it's very interesting. It's the beginning of the meridians, and just about any Japanese practitioner who is interested in pulse diagnosis, what they take the pulse, and if the pulse isn't there, something is not clear, they needle amoxil Ren 12. They retake the pulse. That's standard Japanese stuff that you see everywhere. Okay, there's something about Ren 12 that's very important. It's the master of all the food organs. Okay, so Ren 12 can reflect the stomach, so it's a kind of digestion. It can also reflect neurological disorders or spinal disorders. We say there's a reason for it. It's a little hard to, well, it's not that hard to explain. The Ren 12, Ren 10, and Ren 13 all relate to marrow. Okay, because of the character 1, which apparently I do not have a Han Dynasty dictionary, so I can't verify for you that. Kiku says that that character 1 used to mean something to do with marrow. That it's a container, inside the container, the yellow stuff that's inside the container. So to her that's marrow, because there's a bone containing and the substance, the marrow in there. Therefore relates to brain problems, neurological problems, spinal problems. But what I can tell you for sure is that sometimes Ren 12 or 10 or 13, or combination of all three, can do great for spinal problems. And it can be just digestion, and they can also, there's a lot of problems, you know, just like in TCM, the stomach is the root of postnatal chi, ultimately. So your capacity to digest, okay, you know, which means to extract the strength of the acidity of the stomach and its ability to break down food and therefore absorb it later in the small intestine is going to reflect on Ren 12. It's the capacity of the stomach to expand and contract. The stomach is a sac, okay? That kind of tissue, the Ruget tissue, exists also in the bladder, which is another food organ. It also exists, if you want to see it externally, it exists in the scrotum, it exists in the cervix. Okay, these are places where that tissue, it's kind of a sliding tissue that allows for the expansion. What do the food organs do? They pass and move, they contract and expand, but they don't hoard. Okay, zang means to hoard. The character zang basically means you invaded another country, okay, and you're like an official, you're a minister. Okay, that's why they call it minister or official or something like that. The word, some people like the word. You're some official of your country. You went and invaded this other country, and you hid under the grass. You hid all the crap that you stole from the people the jewels, not the crap. You don't take the crap. So you hide all the loot. That's what zang means. It's hoarding. Okay. Fu, on the other hand, means to exchange. Okay, just like all the fu in the, you know, exchange palaces in the body, mansions or whatever, you know, you have names like 216, Fang Fu and stuff. It's an exchange palace. Okay, it's a marketplace where one person hands over something. That's literally what the character means. So fu, because the stomach is precisely this thing. It's a sac that, and it kind of, it does some of the work, but it's really passing it on. Okay, so that's what the fu organs do. So it's a reflection of all the fu organs. By the way, it's going to be a very important point gynecologically, because the uterus is an extraordinary fu. Okay, so you can see that there's a strong correlation between Ren 12 and uterus issues. Okay, so always worth checking. Ren 12, you have a number of options. Now, don't forget that the stomach is extremely sensitive to stress. How many people have stomach issues and are stressed, you know, that come from stress? Also, the innervation to the stomach comes from T5. So often people have Ren 12 pain will show something on T5 in the back. Okay, there's a correlation. Okay, so some options for releasing Ren 12, and again, you're going to have to prioritize. You may end up having to deal with it in the back with T5 only. So that can happen. But often, it may be a kiddie point that's going to release Ren 12. It can be what we call stomach chi, and I'll show you that in a second. Basically, we're talking, it's the bumps originally we said between stomach 40 and 41, how come there's no points, but there can be all these bumps by the bone. And literally go by the bone. Don't take the second stomach channel. I know most of you needle stomach 36 from the side of the, of the second channel. Go on the bone and find the bumps. When you have bumps, because this is, remember, the lower head points of the large intestine, small intestine, this is the Sea of Chang, right? This is very strongly, you're looking at me like you've never heard that phrase. It's chapter 33 of Ling Shu. There's 4 seas, right? 4 oceans. Ocean of marrow, ocean of grain, ocean of qi, ocean of chang, of blood, ocean of blood. This area is the ocean of blood. Okay? So if you have bumps here, the stomach channel isn't smooth. That's a big deal. Okay, your stomach channel should be smooth, and you'll be shocked at how many people, it's like good. Okay, not a good thing. If you find it, you want to needle it. We say that it relates, originally, Nagano loved stomach 41 originally. Okay, that was his fire point on the earth. It's the mother tonification point on the most important meridian, blah, 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 blah. Like stomach 36, so important. Stomach 41 is mama of stomach 36. Should be more important. Okay, then he started saying, well, actually these bumps are kind of seem to be really useful. He said Nagano, unlike Kiko, was not a palpatory type person. He did everything by pulse. That's my understanding. Okay. He said that there's, we say there's 3 things you should have in the pulse: Shen, depth, and stomach chi. Right? You all read Li Shijian or use some text based on it. It says that the pulse should have 3 things: Shen, depth, and stomach chi. No one can define to you what stomach chi is. Nobody even talks about it. Nagano says that a pulse, he said a stomach chi is a movement. You might call it a slipperiness, a rollingness to the pulse, that the pulse should move. A pulse that doesn't move towards the thumb, but does, it is nothing to do with wiring. It does not have to be wiring. Don't confuse it. It has no movement. It has no wave to it. Okay, that he says is a pulse that has no stomach chi. And I can tell you that if you press on these points and you then take the pulse again, or you keep your hand on the pulse and press, you will feel a softening in the pulse, a movement in the pulse. But it takes time to be able to configure that out. That's why we don't teach it like that. So we say this is the pulse, blah, blah. But stomach chi can also make REN 12 better. Immune point is highly correlated with stomach, with REN 12. Okay, and the other place is Sanjiao 16, which is related to immune. And also sometimes you can, because it relates to the nervous system, we have a point when you fold the ear. You see these tendons? Under the tendon, we call Kawai's thyroid point. It's great for thyroid. Okay, we use it for thyroid. It also, it releases the whole neck in general. And it releases, because it releases the neck, it releases the nervous system. So for many people with nervousness, because their stomach is susceptible to nervousness, this may be the issue. Or more the neck, but then we add the immune point also. Okay? So think, if you want like a more dogma, think REN 12, immune plus stomach, maybe kidney. But, just go with immune and stomach chi. That will be good enough for right now, for basics. REN 15, worry reflex, is the dogma for that is spleen 3 plus pericardium. What does it mean plus pericardium? Check pericardium 8. If there's pressure pain on pericardium 8, needle pericardium 3 and 5. No pressure on pericardium 8. Okay? Either 6 or 4, 3 fingers below 3. How do I, not Kiko, how do I choose which one? I go anywhere on the neck. I don't care where. I'll find something on the neck. Okay, how do I choose? Which one does a better job on REN 15 or the rest of the abdomen? Okay, let's say they're equal, so it's hard to decide which one's better. I go for the neck. Whichever one does, if they're equal in the abdomen, whichever one does a better job in the neck is the winner. Okay, so, and sometimes you don't have a winner, so you just choose one. What the hell? It's got to do something. So, but REN 15 is spleen plus pericardium. Now, that is also correct for REN 17, but not quite so fast. This is your final solution for REN 17. You can add pericardium. Why? Because mu point of pericardium, it's a little dumb to go to the pericardium channel. I mean, any monkey knows that. You know, it's like we want to be sophisticated, right? Also, it's a lymph area. So first, for REN 17, the first thing we do is we release with immune point and we release the neck, which we'll talk about in a second. That's our next subject, to release the neck. Immune point plus either triple warmer 5 or triple warmer 8 to release the SCM. Then if you want, you can add pericardium if you need. Okay, so REN 17, we actually start from the side, this thing from the side inwards. Okay. Last thing before we stop all these damn protocols and do something a little more fun. SCM, very important. The neck is very important in general. Connects the brain and the torso, right? I mean, you can't argue that it's important, okay? So also that same chapter 2 of Ling Shu, when I told you about liver 4, it talks about all the important points below the knees and the elbows, and then it lists what the Worsley School likes to call, you know, the windows of the sky point, which is really a misnomer because it's a one-point name. Only one point is named that, okay? But it doesn't, you know. Then what he's saying is that you have 4 limbs and then you have a 5th limb. It's very important. You can't ignore how important it is, and your whole nervous system goes through here. Okay, so the SCM specifically, 1, 2, 3, maybe 4, depending on how how long the neck is, and you don't press this way. You have to press with a flat hand, and the SCM goes that's not very comfortable. Okay. The thing is, the SCM entraps in it the vagus nerve. The vagus nerve is a parasympathetic nerve. Okay, since it's a parasympathetic nerve, what does it mean? It means it needs to be active for healing. Okay, healing is not a sympathetic function; it's a parasympathetic function. So kind of consider that, So if the SCM is tight, it's obstructing the function of the vagus nerve. So you see all sorts of people who teach Ujjayi breathing as a method of relaxation and stuff. That's what they're trying to do. They're trying to release the vagus nerve. Okay, so it's very important to release the SCM. How do we release the SCM? 1, 2, 3. You found something, let's say on 3. You go opposite side. Now you have to differentiate rapid pulse and slow pulse. Then you have to let go of the dogma. But the dogma says as follows. Slow or normal pulse, use opposite side of the SCM, what we call triple warmer 8, which is about 1/3 down from the elbow. Basically, slide the thumb up when you stop. That's triple warmer 8. And now check if that released the SCM opposite side. If it didn't, you can go slightly towards the small intestine channel. Now, by the way, Sanjiao 8 and immune both get needled towards the small intestine channel, not straight in. Okay? So, triple warmer 8 for slow or regular pulse, Sanjiao 5 for rapid pulse. Okay? So, we're touching on releasing the autonomic nervous system in this. Okay? So now we have a fair amount of things to play with, protocols to play with. Okay, I know you don't remember them all. It's fine, but I just want you to just have an idea. In the back of the neck, we check the cervicals, 1, 2, 3, 4, 5, maybe, depending on how long the neck is. Again, if you want like the simple dogmatic, like, okay, release it with this, generally speaking, you can probably go Sanjiao 8 or Sanjiao 5, same side as the neck. Neck, same side, SCM, opposite side. Okay, so you end up seeing a lot of this triple warmer 8 or triple warmer 5. These are really major points for us. We love triple warmer 5 and 8. Okay, it's like huge for us. Metal water and triple warmer 8 are big to do for us. Okay. Any questions? No?
You had differentiated with the SCM if it's a slow pulse,
Mm-hmm.
and then what if it's a rapid pulse?
Rapid pulse is Sanjiao 5. Just
Okay.
treatment point is different.
Got it.
Now, Nagano had a whole idea that said, slow pulse person, you do not needle the abdomen. That actually makes a lot of sense. And I can extend it to you when you find a person. You'll see Kiko often doesn't take the pulse at all. Okay, it's not uncommon for us not to take pulse. When you find somebody, there's no findings in the abdomen. That's kind of weird. Okay? first thing to do is check the pulse, because if it's a slow pulse, it's not weird at all that they don't show anything in the abdomen. Slow pulse will not show as much in the abdomen. Not all of them, but often they won't. If you think about it, when you activate the lower abdomen, you breathe. Activating the lower abdomen, you're slowing down the pulse. Slow pulse person, you do not want to stimulate the lower abdomen, because all you're doing is slowing down their pulse. It's not a good thing. It's already slow. It doesn't need to get slower. Nobody needs a pulse that's 30 beats a minute. Okay, that's not normal. Okay. So it's abdomen, stimulating abdomen is good for rapid pulse. Okay, that's what Nagano said. As it happens, you can also see lots of people with slow pulse that are not going to reflect a lot in the lower abdomen. On the back, Nagano had the exact opposite theory. He said, don't stimulate the spine for rapid pulse. Okay. Now, you can sort of say, oh, you stimulate the nervous system, you get making them more sympathetic or something. It's not so clear to me. My understanding is, first of all, because I've also seen the technique evolve over 20 years, and I've seen like people will say, but Kiko, but you're doing it anyway. It's like, you know, the thing is, you can't get away from needling, you know, the Wato Jiajis on the spine. I mean, you know, so then we came up with all sorts of cute rules. It's okay as long as you don't do, you know, T12 is okay, but this one is not okay. It's like and then it got to be, don't do the spine, but you can do the bladder channel. And every time there's a different excuse to how there's no clarity with this rapid pulse, don't do the spine. But my opinion is, Nagano apparently saw 100 people a day and lived to be relatively old. He was working for about 50 years or so. I would rather listen and sort of go, don't needle the spine in rapid pulse, and I'll be conservative. On the front, I can tell you, someone with slow pulse, I don't need a lower abdomen. I just don't. Because I totally resonate with the idea. I don't totally resonate with the idea of don't needle the spine, so I'm being conservative, that's all. But slow and rapid pulse were big things for Nagano, and sometimes you'll see that there's different treatments for slow and rapid. Nagano felt that rapid pulse was a sympathetic dominant situation. Slow pulse is a parasympathetic dominant situation. If you ask me, that's a 1950s ideology. That's just, in my opinion, it does not correlate to my personal experience. Okay? Nagano lived in a time when there were two nervous systems. We're living in a time when there's at least three autonomic nervous systems: sympathetic, parasympathetic, and enteric, and possibly more. Okay, so we don't have a good yin-yang correspondence in the nervous system anymore, whereas they used to be. You know, so I respect, you know, what Nagano said, but I also have to accept the fact that some things I don't know why and how, and they don't make sense to me. And I also acknowledge that I go against those rules at times. But the don't needle lower abdomen, I don't go against. In slow pulse, I don't needle the lower abdomen. Does that answer? Yeah. Okay. Anything else?
Can you just say which direction you said you needled?
Triple
Xandra?
warmer?
Yeah.
Kind of towards the small intestine channel.
Okay.
So not superficial. I go in, but I go in at an angle. Generally speaking, I don't needle at 90 degrees, personally. It comes from a sentence in Yang Jitsu in Denjo Dachan that says, I don't know what it means, but it's a sentence A, you know. It's like, he lived 400 years ago, I can't ask him. It says something like, needling at 90 degrees damages the upright chi. So, you know, what do I, of course their needles were much crueler than mine, but, you know, what do I care? A teeny bit of an angle. It's like, you know, no big deal. Generally speaking, most points I needle with a channel. This is clearly not with a channel though. And then some bladder and gallbladder points we needle against. Generally, we're looking for the deficiency, not the excess. We're always looking to tonify deficiency. Okay? But in the case of gallbladder, as it happens, it's different. All right. Would you like to go through more protocols right now, or would you like to see someone on the table? Okay. Somebody with a problem this time, so it will be a treatment. You've got a problem.
I have major nasal congestion.
Okay, yeah, you
Always.
Oh, yeah. Okay, hold on one second. Let's see if anybody else does. Go going once, going twice. No. Good.
Autoimmune.
Hmm?
Autoimmune.
Okay, autoimmune is always fun. Yeah, okay. And nothing autoimmune for you, right?
Not that I know of, just neck pain.
Oh, just neck pain. Okay. All right.
Tennis elbow, that's all right.
All right. So you have choices. Neck pain, autoimmune, what kind?
Crohn's.
Crohn's. Okay. Which means that you can't see the full treatment because I can't do Rent 4 on her, but that's okay. So autoimmune Crohn's, nasal congestion, neck pain, tennis elbow. Who do you want to see on the table?
This is tennis elbow.
You want tennis elbow. You do lots of sports injuries with your intelligent patients?
No, it's not that actually. Again, I'm a little,
It's practical.
Based on my experience, from what I've seen so far, Keiko is very good for constitutional treatment. For B syndrome, for sports injury, I don't think it's the best. But
I
maybe
disagree.
because I haven't been able to make a difference,
Okay.
so that's why.
Any kind of, okay, so he wants tennis elbow. Anybody seconds in? Okay, anybody oppose? Okay, tennis elbow, come on in. Do you want his shirt off? What's your medical history? Ah. Yeah, I mean, make it interesting
Pretty
for us.
healthy, pretty healthy.
Pretty healthy, but?
I have had both tennis and golf elbow issues
Okay,
for like 3 or 4 months. This is going on 4 months this time.
okay, hold on,
It's not
hold
really
on.
bad.
I get the tennis elbow. Besides the tennis elbow, what else do you have in life?
Let's see.
I mean, you're not 20, so you've had
Constipated for a
something.
long time.
Still?
Migraine headaches, but I don't have them anymore. Just the flashing lights, but no pain.
Just flashing lights,
Yeah.
okay.
What else? Digestion, most of my life issues. Yeah, constipation.
Well, just constipation or other digestive problems?
Just constipation, and the last 2-3 years has been good.
Okay, what changed?
Diet, mostly.
Okay, when did the headaches change to just flashing?
Probably, I started treating them, I guess, about 30 years ago, and they went away about 15 years ago. And that was stretching, diet, lifestyle, everything. Really changed my
Okay,
body.
where was the headache when you had the headache?
It was move around, but mostly back here.
Okay. Parents, grandparents, any diseases?
Mother had migraines.
Uh-huh.
Alzheimer's. Grandparents.
Mhm.
What else? Not much. Pretty healthy, actually.
Okay, so up to now, medical history is digestion, migraines, and you've had this thing, and it's the right arm?
Right now, it's the right arm. Yeah.
Oh, it's been on the left?
I've had it both. Yeah.
What do you do for a living besides acupuncture? Did you do something?
I was
did you
doing
start?
camera work, holding heavy
Okay, so you think
television
that's where
camera.
it came from?
Yes, grabbing things, and because actually, if I stop using my thumb, it would get better.
Okay.
To grasp things, that's one of the things.
All right.
And what else? Oh, palpitations. Also, I've had that issue for a while.
Ah.
Mm-hmm.
Okay. Lie down face up.
Strong pulse down there too, for a long time.
Uh-huh. All right.
So for your tennis elbow, are you currently hurting? It's currently hurting.
You know, I had a pretty good acupuncture treatment on Wednesday, and it's much better, but it's still there.
What points do you use?
You know, actually, did the opposite.
just call it doesn't matter because I'll probably do something else.
I think you probably will.
All right. Do you know what your blood pressure is? By numbers? Always ask the numbers. Don't let them tell you okay, because it's always weird.
It is okay. I don't remember the numbers.
Okay.
It's a little lower than normal.
Uh-huh.
It's not high.
Okay, it's not high, so therefore it's good. And then you have people who have 105 over 80. Each number on its own sounds fine, but the difference is too small. Okay, so you have to watch out for these because they will be. The reason I'm asking is because he has something in the pulse that, to me, indicates, something in the autonomic nervous system. So I'm always asking those people what their blood pressure is, because it can show as blood pressure kind of situations. Okay. All right. Any pain when I press
Ow.
one? 2, 3. So this one out.
Yes.
Okay. And the tennis, 2, 3. No.
Nothing.
Okay. Best point supposedly for tennis elbow without dealing with anything is ow. Go to the up to heart 3. Relax. Okay. Heart 3. Hi. How's now?
The pain is better, about 35%.
Okay. So that's a trick. Okay. I'm not interested in it. I can add at the end. No big deal. Okay. So I'm interested in what can I do besides. Now, another possibility is, and you're very sunk in the pectoralis. Okay, because you well, actually, no.
Straight off?
No, it doesn't matter, because it doesn't show. But when I touch, it's like it's falling in, okay? Any discomfort here?
No.
Okay, compare this side.
It's a little
But that's,
sensitive,
you
but-
have palpitations, so that's probably this side. So if it was pectoralis, okay, no. I'm just checking, like, first, I am not doing abdominal diagnosis. Yes, I'm just sort of looking like orthopedic type test, to see. Now, is there anything in the scale? Yeah, you're very tight here.
Tight, but not painful.
Okay, but tight.
Mm-hmm.
Okay. When I press here, how's ouch?
Ow.
Still ouch.
No
Okay,
change.
hold on. I just want to see what's the relationship. And now,
Better.
by how much?
100%.
100.
Oh, back to 80%.
Okay, wait. Where is it now?
It's about 80.
80% gone or 80% better?
80% better.
80% better. So 20% left. Okay. So releasing the scalings is very important. Okay.
Is it Kidney 27?
Hmm?
Is it Kidney 27?
No. Stomach 11. Stomach 11. Yeah, stomach 11 type. Yeah. Scalings. Okay. All right. But let's check his abdomen. Because if I just do the trick. Okay. So I've got a bunch of tricks. I satisfy my ego that, I can get him to say that it's better. Good. I'm a good person. Now I have to do my job. Okay, my job is to treat.
You have the patient interested too.
No. The patient's interested in the symptom. You're absolutely correct. But the thing is, if I just treat the symptom and I don't treat the constitution, chances are the symptom can come back more easily than if I don't. It's not worth it for me. Okay. Now, the thing is, because of the headaches that, I also knew that besides the fact that the blood supply to the arm comes from here, I knew because of the migraines that he's got a chance of being very tight in the neck. That's all. Okay? So, let's check abdomen. So, when I poke here, nothing, right? Just my fingers. Okay. If you feel something more than my fingers somewhere else, let me know. Hi.
A little tight.
Okay, so that's oketsu. Hi.
A little tight.
Tight. How about here?
Not much, but a little.
But I can feel the pulse already.
Yeah.
And here,
Not much.
okay. 9.
Yeah.
Yes.
A little
Okay.
sharp.
12
Yeah, a little sharp.
and 15.
Not much.
21.
Yeah.
Okay. 21 this side.
No.
So we say stomach 21 is the stomach moves towards the right side. Duodenal ulcer on the left and stomach ulcer on the right. So it seems like something in this duodenum. It doesn't have to be ulcer, but suddenly something in the duodenum. That's what stomach 21 on the right side reflects. That's his right side. Sorry.
Yeah.
It's your right side. Yeah, that is the duodenal because that relates to liver, etc. Tell me if there's any difference between the left side and the right side.
Right's a little tighter.
Right, a little tighter. How about here? Liver 14. No. Okay. You can also see he has these, he has a tight diaphragm. He has all these, no, the blood, the veins that come out.
Varicose veins?
Yeah. All right. So up to now, you had digestion, a little adrenal, Ren 9. Did you, Ren 12? Yes. Stomach 21. Okay, and a little bit here. Okay. No?
Not much there, no.
Not much, but in comparison to this side, that's how you
Yeah,
could tell. Okay.
right.
Liver, you have to check in comparison. I checked both under the ribs and liver 14. Okay. SCM 1, 2, 3, 4.
Ooh, 4. Wow.
3 and 4.
Went all
Okay.
the way down to the arm.
It went. Okay.
It went all the way down to the arm when you pressed
So
it.
his tennis elbow is SCM elbow. Not okay. Height 1, 2, 3, 4.
4.
4, but not as icky as this one,
No,
right?
not as
Yeah, because
intense.
I can feel in my fingers. Okay, I'm under, and I'm actually on the right side. I'm pulling towards me at the cervicals. I'm going like this. Okay, so relax. 1, 2, icky. 3, 4, 5. I think 2. No.
2, 3, 4, but 2 is most.
Okay, 2, 3, and 4. I'll take all of them. Okay, 1, 2, 3, 4.
3, but not as bad.
Okay, and anything on 17? I'm checking cardiac because he has palpitations.
No.
Okay, pericardium 1.
A little bit there.
Okay, stomach 18. Okay, and pathognomonic for heart, beside, he had spleen 20, we know that because I checked before. Small intestine 11.
Oh.
Okay, so cardiac. Okay, he's clearly cardiac. Plus Ren 12, adrenal Ren 9 is most important, and the neck is most important. So now, okay, so that these are my findings, and the history is of migraines, something in the head, and digestion. That's the history. So now how do I need to now, when I call it, making it, I'm basically making a story up. And, you know, literally like a fairy tale, if you like. And then I'm going to check if my story is correct. Okay? And my story is going to be, you know, it's not Hansel and Gretel went and, I mean, well, I'm looking after the breadcrumbs that he gave me. Okay? So the things that stick to me, first of all, he has a clearly cardiac, I'm more interested in the cardiac personally than I'm interested in the tennis elbow, but that's me. Okay? He didn't come here saying, by the way, I have palpitations. He donated that extra information so I can treat the elbow. Okay? But I'm going to have to start thinking, is that most important? So now, because my main point for that would be Ren 4. Ren 4 is called Guanyuan, the gateway, the gate to the primary. This yuan is written like the head over the legs, meaning it's not source, it's primary. There's a difference. Do you see the difference? Primary meaning as it comes from the head. Source means, you know, when you use source points, that yuan, it's a different yuan. It's like the beginning of a river. It has the character for water. It's a different character, okay? So he has head problems. He has cardiac. For me, cardiac, Ren 4 is an important point for cardiac. So first of all, let me check if it does the cardiac, so to see if it's worth moving on. Okay. You had here, hold on, oh, you have here, I don't care if this hurts. You had here, right?
Not so much.
Before you had. No? Okay, fine. You have here, and you have, sorry, don't help, and you have here, right? Okay. The one that's important is small intestine 11. Ren 4, go. Hi, how's small intestine 11 in the back?
100% better.
100% better, okay. So I satisfied my curiosity that this could be, that there's a cardiac connection here within the cardiac. Now I want to know how far does this cardiac connection go. Number 1, you had 3 and 4 radiating to the arm. How are they now?
Nothing.
Nothing. Okay, cool.
No pain.
How is ouchie, ouchie, bouchie?
About 30%.
30% left or 30% gone?
30% pain.
Okay, 30% left. Not bad, considering that not supposed to be related to begin with. What the hell? So all I'm telling you is that treating constitution will affect everything else. Okay? So this whole theory of root branch, there's no difference between the branch and the root. The tree cannot exist without the leaves. It cannot exist without the roots. Both can affect each other and both are just as important. Okay? Now, but remember he had Ren 9 pulse. I have a great substitute for Ren 4 that I want to try, which is called Mushu. Okay? Because if I press Ren 4, I can't check the abdomen. Okay? So I want to see what happens when I do Mushu. Okay? This is, I start with the right side, I told you, because it's blood. Oh, no, you won't understand this explanation. Forget it. No, because you don't speak the right language for it. Okay. How is right stomach 27 now?
Better.
How much is left?
Too much.
Better is not an answer
I
from
can't
any
remember.
patient. Is there anything? Okay. Does it bother you now?
No.
Okay. If you can't remember it, but it doesn't bother. Okay. Adrenal left, still some, I think.
Still, yeah.
Okay. Is it better than before or not?
No.
Okay, fine, no problem. Adrenal right.
Better.
Okay, maybe left doesn't get affected. Okay, but supposed to work on Ren 9. How's Ren 9?
About 50% better.
Okay, there's another side. Okay, and you had, well, 12.
Still better.
Okay, 12 doesn't get affected. How's ouchie bouchie?
I don't feel any pain.
Whatever you call it, I don't care. Okay, fine. So mush. So all I'm doing right now, I'm not needling yet. I'm not into. I found it. Let's go. Give it a moment. Think. Figure out what else you can do, because don't go for something that's going to obliterate everything and then you have nothing else to go with. Because how am I going to know what else to do? It's called take insurance. You did your essentials and then not bill insurance, take insurance. To make sure that he really it will stay better. By the way, Heart 3 worked for, right, Heart 3 did how much for this?
About 80% better.
80% better,
Yeah.
okay. So, Heart 3, don't you think relates to Rend 4, Heart? It's like just a moo point, right? Okay, now, but he has adrenal, so let me see what, okay, so first of all, any pain on kidney 2?
Yes.
Yes, and this one?
No.
Okay, so it's totally allowed that different kidney 2 one-sided, just like pericarditis, you go with what there is. Now notice kidney 2, I don't press one point, because I press one point, almost everybody will say pain.
Yeah.
I slide. Okay,
Huh.
the other ones, spleen 2, liver 2, spleen 2, I press, but kidney 2 is a slider. Okay, so this side kidney 2 pain. Okay.
I see
So-
it's better now.
But
A little bit, yeah.
okay, a little. Okay, kidney. Okay, kidney 7. I'm looking for. I look for that there should be something interesting, you know, not just okay. That's the location. Okay, how is here?
Still about the same, no change.
No change. Bummer. Okay, how is no? It's okay. Kidney below kidney 16.
That's better.
That's better. Okay. It probably won't change this side because it's one side for one side. So, okay. So, this side I can do original adrenal treatment, which is kidney 6, or I'll do kidney 7, depending. Hi, how's kidney? No good.
Kidney 7 is painful. But
Kidney 6, first of all,
Sorry.
16.
Sorry.
This is my
Kidney 7.
target.
Yeah.
No better.
What are we asking? What's better?
This thing here,
Abdomen? Okay.
you have here, I don't care if this hurts right this second, but
Okay.
is kidney 16 better? 16.
Yes.
How much better?
20%.
Okay, let's go for. It's okay. Okay, thank you. Hi.
It's gone, no pain.
Okay, so kidney 7 is the right point for him. Okay, so now we can start.
Who's kidney 9 for adrenal?
You can use kidney 9 for adrenal. I would use kidney 9 when, if they show liver, for example. I mean, it's not liver excess, because liver excess has a kidney 7 combination. Certain liver excesses involved with kidney 7. I'd use kidney 9 if there's toxicity involved, if there's skin problems, if there's thyroid enlargement problems. Okay. Now, I do need to check something with the kidney 7, which is the neck. Kidney meridian circles in the neck at the end. So, one of my checks, okay, you said here, right? Boom.
2 or 3 on there, wasn't it?
Yeah. 1, 2, 3, 4.
Almost 4.
4. Okay.
They'll actually, they might be better.
Okay, that's okay. That's good. Hi.
No,
Even?
no pain.
Okay. That's really what I care for. So I just confirm every point I can with as much as I can. Then, on the other side, you had here and here, right?
Yeah.
All right. How's now?
Better, like 80%.
Okay, and above it?
Don't feel anything.
Okay. Would you bend this leg for me because can't reach so easily? And you had number 2, right?
Yeah.
Okay. How's number 2 now?
About 30% better.
Okay, hold on. No.
80% covered.
Okay, good. So now I can't move this finger because that was a problematic place to respond. So it has to be exact. All right. So, by the way, I use number 1, meaning I think it's 0.16, number 1. And generally I use 30 millimeters. I don't need more. And if you want to look at how much of the needle I'm using, look, almost nothing. Okay. And technique-wise, I'm just like that. Right hand. I
was saying, do you
No,
go
no,
until
just-
it stops after the tap, or no? The first area where it hits, or
You'll
no?
figure out. You're trying to break down connective tissue, so yes, you have the right idea.
Okay.
I can't
That's
say.
another Japanese teacher had said this goes.
I get it.
Just
But
curious.
I can't quite say 100% that.
All right.
Okay. So we'll add 27. Because
Maybe
we're
if you're
doing,
checking Ren 9, will you also be looking for the pulsing to go down?
okay. Yes, but I've never seen a case where the pulse totally disappears on the table. It will calm down to some extent.
But
And
you're
like I
not
said,
looking
Mushu
for
is
that.
better. I am looking for it to calm down, but not it just practically speaking, it's not likely to disappear on the table. It's just, that's going to be a time thing, because if it's a weakness in the tissue, you can't strengthen. You're not Popeye. It's like eat the spinach and whoops, it's gone. It just isn't going to happen quite like that. So, checking adrenal left,
50% better.
only 50. It's okay. It's what is.
Yeah.
Oh,
still,
it's
still 50. Yeah.
yeah, okay.
Still
Okay,
something
so I
there.
have okay, and right side,
Better, but only about 30%.
30% left and 50% right. Okay, so the adrenal is somehow not quite doing it. But hold on, house 12,
Better, about 30%.
30% left.
Yeah.
Okay, let's go for Mushu and see where things are going to be. So, adrenal left
Almost gone.
and adrenal right.
Gone.
Okay, great. And then I can still add Ren 4. Now, I happen to like to combine Mushu with something in the neck or Yubito. I call it coordination of the 3 dantians. Okay, so now this is an aviism. First of all, the whole Mushu thing is an aviism. It comes from Kiko originally, but I kind of took it like, I've made my own stuff out of it. So if you go to Kiko and you say Avi does this and Avi combines with this, it's kind of, okay, that's not, she can't tell you anything about it because it's not her thing. It's not her style.
Is that the same as her thinking slice?
Sorry?
Is that the same?
It's
as
exactly the
slice?
same thing as Dantian slice. It's the exact same point, yes. So, all right. House 12 now.
Still about 30-40% pain or sensitivity.
Remember, I can do immune on this side, but he originally had some problem here too. Tennis elbow, he said, had both sides. So remember, my target in some ways is really Ren 4. Okay, but before I get there, because I know he has blood pressure issues, or I think he does because he has low, under third toe, but on the toe, where the toe meets the body. Hi. How's Ren 12 now?
That's only about 10%.
Okay.
What
sensitivity.
is the under the third toe? Is that are those the Dre?
No, that's not a Jue. No, that's not Jue. Jue is a different area. Jue is below liver 3. It's this line here. Okay, in a second I'll try and show you that. So, no, nothing to do with. And take the third toe. And go to where the toe meets the foot. In the middle. That's under the third toe.
Is that the blood pressure?
That's the blood pressure point. Okay. Better for rapid, does not work so well for slow pulse, and only use it if they have an autonomic nervous system pulse if they have slow pulse. Okay, so you have to be very clear. Autonomic nervous system pulse is a pulse that's now going to call it tight pulse. Okay, now you will define that pulse, and you will be 100% wrong, but this is your language, so it's fine. You will define it as a wiry pulse, usually thin. In his case, it's not a deficient pulse. In his case, it's strong. And when you press on it, it either disappears. Nagano said disappear. I believe that doesn't have to disappear fully. It changes quality is good enough. It becomes wider, softer. But it's that tightness that you're looking for at the top that changes at the bottom. The reason why wiry is not a correct description for it is wiry is an excess pulse. When you're looking at the 21 pulses, wiry is an excess pulse. So a lot of these people have weak pulses. Therefore, it's a tight pulse. Wiry is, Nagano said, wiry pulse is people with Parkinson's. That's a gallbladder 39 indication. Okay, so under the third toe, now I just use a different kind of needle, and in this case, it's a sarin, because nobody likes to, pointing at things, So, but this won't be a problem. Oops, relax. You okay?
Really felt it.
Good. Better not to feel. You don't need to feel the chi. When you touch someone, that's the chi. By the way, he has bumps. If you want to feel. I mean, women usually have more clear bumps. You can slide.
I'll do this first.
All right. Okay. Feel my bumps. How's 12 now? Okay, so we haven't touched the elbow, basically. We've just because you said, you think, okay. How is now?
Well, a little bit of pain there still. It's still about
Percentages.
30%,
30%. Okay.
25.
Okay, now I feel I've done a fair amount for his constitution. I can go for Ren 4, first of all. Okay, is it here or here? This one, huh?
Number 2.
Number 2, okay. Sorry. Oh.
Yeah, sounds good.
Because before it was higher, so
Really?
something changed. Yeah, it's okay. Hi, Ren 4. How much is left now?
Barely any.
Barely.
20%.
This one's deeper. Okay, this one is not like. So here, yes, I'm actually looking for a place where it's not going to let me in, and then I'm pecking on it. All right. So how we know what's left?
Still about 25.
25. Okay. And okay. You had here are these okay now?
About 4. That one's a little sensitive. Yeah.
That's a little sensitive. Okay, so before if I put a needle, I want to release it first. So, triple, just because I want to show you, it's not the best. It's a little low for triple wall rate. Maybe it will work. Hi.
Not much pain at all.
Not much pain at all. Okay. And how about here?
Gone.
Okay. Do you see how he breathes? And there's that jumping thing? That's a Ren 9 pulse.
About 10%.
10%. Okay. So now let's do the dogma for Ren 9 pulse. Okay. So just because I ignore the dogma doesn't mean at the end I don't come back to it. Okay. So. So angle that way. And you can take stomach 24 a little further out if you want. In fact, I probably should have. Anything left here?
No.
Are you okay?
Mhm.
You sure?
I think so.
Okay. Well, I can't think for you. Such high hips. Interesting. All right. And you had 10%. What do you give us now?
0.
0. Okay, I'll buy 0. Okay, so I think Kiko style is allowed to work for. No, I'm kidding. it will work on orthopedic problems. In fact, we have a whole way of thinking just structurally. The thing is, it's harder to apply because for the practitioner, because what happens is we all have a tendency to say, this is an orthopedic problem. And instead of treating the person, which is the whole style relies on doing the person first, deal with it. If the person says structure is primary, deal with structure. But because we're so inclined to say it's an orthopedic problem, I want to solve it orthopedically. This style is not going to work as well because you're going to go there all the time. And what you need to do is go here, go to his medical history, and then check everything you do against that as well. But start here.
So you refer
Does that
back
make
to
sense?
that always, but you're constantly just going through what.
I'm always referring back to this, and that's why I was kind of surprised when he says, oh, I know that Kiko styles were good for constitutional stuff, because most people say exactly the opposite, because they're looking at what she's doing and she's always checking the problem, and they're going, Kiko style is just treating the symptom, it doesn't treat the root. You know, so it's kind of funny that he actually has the opposite impression. And again, because what they're seeing is she's always checking the elbow, but she's also checking the person.
Right.
You know, check both. Don't ignore.
Not separate.
Yeah. So you were going to say something?
No, I think for sports injury, a lot of time it is structural. So some of these things, for example.
Why do you think their structure is going that way?
That's just the thing. It's not mutually exclusive. Okay, so I do understand that pain is, at the end of the day, is a very subjective experience. So you can take care of a lot of constitutional issues. He will feel better. He will heal quick. That goes without saying.
Yeah.
So what you do is you will do absolutely understand the
Wait, but you were talking about something a little bit, I think you might be talking about something else. If you're talking about someone who has a sports injury, meaning it's in the last few weeks, yes, I believe you're correct that this style is not the most important thing. Because, you know, I went skiing yesterday and this happened, and can you fix me now? This is probably not your best approach. I totally agree, because first of all, it's too time consuming. And you know, you can because you don't need to deal with a constant. I mean, for what they came for, which is my ankle's fucked up. You know, deal with it. I don't give a damn about anything else. Don't. Yeah, you will be better off with other things because it'll be faster for you.
But it's not healing.
If it's not healing, then you move on. But you know, it's like, but no. But that's the thing. He's talking about the highly intelligent people who are weekend warriors. You know, who come with injuries.
And you're telling them it's your heart. They're like,
they don't need it.
Yeah.
They don't need that kind of stuff.
Yeah.
You know, so I think you're correct in that respect. You know,
That's possible.
yeah. But he's had it for 3 months.
why is it getting better?
So it's a teeny bit different. But yeah, for the person who says, this sucks because I did too much of this and blah blah blah, and fix it now. Yeah, this is probably too much effort. Not worth it. So, yeah. No worries. All right. So I want to show you a few other things. Okay. So if you all stand up. Now, you exempt. The dog ate your homework. So, this is called the heel, and this is called the ankle. Okay, I know you know, but I want to remind you. This is the heel, and this is the ankle. Okay, what you're going to do is you're going to push the heel to the floor. Wait. Oh, okay, yeah, I do better off without shoes, it's true. You're going to push the heel to the floor, and you're going to lift the ankle bone away from it. I like the two different socks. So, that's why the nose is running. So now notice that what you probably want to go, as you push the heel down, and now you lift the ankle away from it, you're going to want to do this. Roll over to the bladder channel. Don't let that happen. Keep spleen 3 on the ground. Anchor yourself at spleen 3, push the heel down, and lift the ankle bone. What are you feeling?
Pain.
Told you it's the socks. Yes, you're feeling the inner thigh. Most of you should, and you should. If you allow this to continue, you'll feel the lower abdomen. Okay, you can let go of that. Okay. What you've seen is the activation of kidney 6. If you split between the heel and the ankle bone, what's between there is kidney 6. If you activate kidney 6, you're creating the perineal floor, basically,
Yeah, it's
which starts between your legs. So you would call what the Indians will call mula bandha.
Yeah, I felt
Okay.
that earlier.
So that's what. Okay, now you have pain, which basically where's the pain?
Oh, it was in all over my feet.
Interesting. Okay, we'll look at that afterwards. Now, so that's what you're seeing is the activation of kidney 6. Then so your uprightness is relying on something in the feet, and it creates something here. So we have we take liver 9, but move it to the kidney channel. But liver 9 would work just as well. We call inner yin. It's a really important point for us. You don't see Kiko using it so much. Originally it was for trapezius pain, and left side we use for constipation. But I'm telling you that it's a great point for lots and lots of other things. Why? Because it's part of that path of creating that uprightness. Okay, so as you activate kidney 6 and you activate the inner thigh, you get your perineum, and now you can, if you do it again, now you can start feeling, and everybody's going to be different in their capacity, you can start feeling the front of your spine, and you will probably get stuck somewhere. You won't be able to continue, and some of you will be able to continue all the way up to your, to the throat. Okay, so that slight lifting of the perineal activates the spine. Okay, and let go of your shoulders. You don't need to be upright or anything. And so what you're discovering is that the legs activate the spine, and what most people do is they have, you can let go, they have nothing in the legs, and they're sinking, and where they're going to sink is T11, 12, because that's a transitional place, because there are no bones in the waist to lift you up. So the ribs are going to fall, and the other end, so that's part of the curve, L2 is like the height of the lordosis, and then it turns around at T11, 12, and then your kyphotic curve starts. So T11, 12 is the start of the kyphotic curve, and the height of it is around T5. T5 and T12 on the back, T11, 12 on the back are going to be extremely important from just about anyone. You need to somehow lift them up. If you create this lift for people, and Mushu is part of that lift. Okay? The reason why I like combining, except I can't combine it for him in the neck, so I'll combine it with something else maybe in a second, is because he has neck problems. And I definitely don't want to touch his anywhere by the eyes, because he has this, other stuff which we haven't looked at. Like I said, bright lights or something. Okay. Question for you. So just to sort of see how a lot of these meridians actually don't relate to medicine. They relate to meditation, to the martial arts kind of thing. Okay. Anything left here?
Maybe 10%, 5%.
Here? 10%? Okay. No, I don't know. I don't think this one yet.
Well, that's a little sensitive.
Yeah. Okay, sorry. How is now?
Nothing on the elbow.
Nothing. Okay, that's the one I'm looking for. Okay, so I have, if you're looking, one of my students called this tooth fairy, okay, because it's under the teeth. Okay, what will happen is, I can't go to stomach 9 on him. I would have. Okay, either stomach 9 or UB2 will be my standard combination, but I have an alternate which is above, like here, and the reason why is because what happens is most people try and lift themselves up from here or from the neck. They're desperately trying to get up because they have nothing in the legs. Okay, so but they're still upright somehow. So if you can release this area, the shoulder blades, or the back will get better, because you're gonna, how people tell, activate your core. They're like, what do you mean? Like go like Schwarzenegger. Like that, the core has nothing to do with the abdomen. The core has to do with a thought pattern. And since their brain can't connect here, can't connect with the legs, so they're holding here. What you're hoping you'll do is when you release here or wherever, when you release here, if they're still capable of making the connection between the brain and the perineum, they will, because they now don't have a choice. Some people this won't work on because their brain's no longer, that connection is lost totally for them. Or it's lost to such a degree that they can't activate it. But if they can activate it, but they're lazy, they're not, by releasing this, you can get something. So often, I will use those. I have to walk around because, sorry. So he said there was 10% left. So I'd rather have no percent left, right? So here. Okay. Sorry. How's now?
100% gone there.
100% gone there, but you don't like the tooth. I'm sorry. Still 100% gone?
Yes.
And the tooth is okay, right?
Yes.
Okay. And this one I want to do the other side because otherwise I'm lifting him just on one side. It's not a good thing, you know. So it's not because it's more an aesthetics thing kind of situation. Less tight here, right? Interesting. And this point can be literally anywhere. It can be closer to the Adam's apple. It can be closer to the front of the jaw. I mean, you know, it doesn't have to be in a particular place.
Are you locating it like next to the bone?
I
Just
prefer
under,
it's
or
under the bone. Yeah,
kind of
yeah.
on the edge of it?
yeah. Because remember, I'm starting with it at kidney. I mean, this whole idea. I mean, some people I do kidney 6, inner yin, mushu, and either stomach 9 UB2, and that's their treatment. Okay, just establishing this fluffiness is good. That's provides them it's providing them space and light. Okay, and that's it. Forget all the other protocols. But mostly, if I do that, I will then go and that's why before I check what works to release the album, because I want to offering the opening is more important than anything. But then I want to direct the treatment. So I better check in advance that I know how to direct the treatment, then I can also provide the opening. But if I provide the opening, then I have nothing to check how to direct the treatment. So then I become one of those people who do stomach 36, large intestine 4 in everybody because I don't know how to direct the treatment. So, except I invented my own combination for it. So, kidney 6, inner yin, mushu, stomach 9 or UB2. But I want to be able to direct more. So that's why I do check all the protocols. Make sense? All right. Any questions?
Can you show me where you can go kidney 6?
Yeah. These, I wouldn't worry too much about it because the way we needle it is totally this way.
Okay.
So we're not trying to get in between the bones. So we're not that concerned. Okay? But there's usually a little bit of a depression. In his case, there's actually a puffiness. So I would say it's here, and I can't see what I'm doing, but I'm assuming. Okay, so just look, there's a sort of a depression there, but it's not a big deal because and by the way, there is no such thing, in my opinion, these are just opinions, okay, you don't take them, they're not written in stone, they're just my opinions. I don't believe there's a Chinese kidney 6 and a Japanese kidney 6. People, I know people love this thing because I hear it all the time. Japanese kidney 6. Like, what? There's a kidney 6, period. But it's an area, so it can go in different places. And yes, some people like it close to the ankle. Some people like it lower, whatever. But so what you want to do is make sure that it affects all these questions about where is this point. Once you start allowing yourself to poke around, the question, you understand that the question is kind of irrelevant. The point is where you want to put, I once went in, the person who assists Kiko now, well, actually, no, she doesn't, but the person who's writing the book with Kiko now, her name is Monica. And she generally doesn't assist her in class. But one day she does spleen 5 here, okay? I'm going, Monica, spleen 5. She said, it works. That's basically the answer. Okay, there's something to say about elegance and intention, all that kind of stuff, but it works, it works. Forget, call it spleen 5 3/4, call it spleen 5 liver 4 combo. Who cares? Do you know what I'm saying? It's so all these ideas about the point is here, the point is here, the point is here, lose their charge, because you're not trusting someone else's understanding of where things are. You're trusting your hands and what the patient. That's the other thing, is the one thing you have to understand about this style. If you're the kind of person who likes to do talking to people and impressing on them how important you are. Okay, that's a little bit unfair, but no. The people tell you to do paleo diet and this enzyme and that enzyme stuff. You can't do this with this style because the patient is in total control. You can't do like what some people say. Oh, your pulse is not. I can feel your spleen is rising now. Really? Oh, that's cool. I like that. It doesn't work with this style because the patient can tell the moment you convince the patient that the abdomen has to get better, and they get that that's what's happening within the treatment too, you can't cheat. The person who's in control